Welcome to the deep dive. Today we're looking at something kind of insidious, a hidden danger that could be right there in your horse's environment, even places you think are totally safe.
Exactly. We're diving into cardiotoxic plants affecting horses.
Cardiotoxic. Sounds serious.
It is. Basically, these plants have toxins that directly target the heart muscle, its rhythm, its electrical system, and they can act fast, really fast. So recognizing them and the signs is critical.
Right. So our mission today is to take all this pretty dense info from our sources and make it really clear, really actionable for you, the listener.
Yeah.
We want you to leave this feeling like you know what to look out for, truly prepared.
Okay, let's unpack this then. What exactly are these cardiotoxic plants? Break it down for us.
Well, at the heart of it, no pun intended, many of the main culprits contain what we call cardiac glycosides.
Cardiac glycosides, okay.
Yeah, these compounds mess directly with the heart's pumping mechanism and rhythm. Think plants like oleander, foxglove, lily-of-the-valley, dogbane, even some milkweeds.
Oleander rings a bell. You hear about that one. You do. And for good reason. It's probably the most common one horses encounter in poisoning cases from this group. Definitely one to remember.
So oleander's the big one in that group. Are there others? Plants that maybe work differently but still damage the heart?
Oh, absolutely. It's not just the glycosides. You've got yew, which is another really dangerous one. Then there's a group with granotoxins.
Granotoxins.
Yeah, things like rhododendron, azaleas, mountain laurel, Pieris japonica, also avocado, believe it or not.
Avocado. Wow.
Yep. And death camas, cheeseweed mallow.
Oh.
Oh, and white snakeroot. That one has a toxin called trimetol, which hits multiple systems, including the heart.
That's quite a list. Are these everywhere? Should we be equally worried about, say, avocado and oleander?
Good question. Not equally, no. Their prevalence varies a lot. Oleander, as I said, very common ornamental shrub, especially across the southern U.S. You see it everywhere. Granotoxin plants like rhododendrons. Pretty widespread across the country. Cheeseweed mallow is a common pasture weed in many places. Avocado is mostly grown commercially in California and Florida. Death camas pops up more in the spring.
Okay.
But importantly, actual poisonings from yew, death camas, avocado, those granotoxin plants, even cheeseweed mallow, they're reported less often in horses compared to oleander.
Sure.
So context matters. If you're in the South, oleander is definitely the silent assassin you need to be most aware of.
Got it. So oleander is high priority awareness. Okay, we know the what. Now, here's what really gets me. How? How do these plants, some looking so harmless, cause such, rapid and devastating damage? What's actually happening inside the horse?
Yeah, it's pretty dramatic physiology. Think of it like this. These toxins get absorbed really quickly from the gut,
Okay.
and they make a beeline for the heart's electrical control system. Those cardiac glycosides we mentioned from oleander, foxglove, they basically sabotage a crucial pump, the sodium-potassium pump, in the heart cells.
Sodium-potassium pump. Right, basic cell function.
Exactly. Messing with that pump causes a buildup of calcium inside the cells. This throws everything off. The heart muscle might contract too strongly at first, but the real problem is the disruption to the electrical signals.
So it messes up the rhythm.
Big time. You get arrhythmias, the heart might beat way too slow, that's bradycardia, or dangerously fast and irregularly tachycardia, or you get blocked signals, dropped beats. It's electrical chaos.
Like faulty wiring causing shorts and surges.
That's a great analogy, yeah. And it's not just the glycosides. Yew contains taxine alkaloids. They also mess with calcium, but more by depressing the heart's ability to generate a beat properly. Plus, yew has other nasty stuff causing colic.
Double trouble.
Right. And then the granotoxins and rhododendrons and azaleas, they lock sodium channels open, so the heart cells stay switched on, depolarized, and can't reset properly to beat again. It affects muscles and nerves, too.
Okay, so different methods, same disastrous result for the heart. What about avocado? You mentioned that one.
Avocado has a compound called persin. The exact mechanism isn't perfectly understood, but we know it causes heart muscle damage, fluid buildup, edema, and respiratory distress.
And death comas?
That one contains steroidal alkaloids. They tend to cause a drop in blood pressure, slow the heart rate, and can lead to respiratory depression.
Okay. And cheeseweed mallow. You said that one affects muscle too.
Yeah, the suspect, there are these cyclopropene fatty acids. They seem to interfere with how cells use fat for energy, leading to muscle damage, including the heart muscle cardiomyopathy.
Wow. And white snakeroot.
Tremetol, its toxin, is well known for causing muscle tremors, the trembles, and liver damage. But it absolutely causes myocardial degeneration too, heart muscle death.
So it's primarily the cardiovascular system getting hit and often the GI tract too.
Exactly. Those are the main targets. Direct assault on the heart and often significant gastrointestinal upset as well.
It's just terrifying how targeted these toxins are.
Uh,
So thinking practically now for the horse owner listening, how does exposure actually happen? You said horses usually avoid these plants because they taste bad.
that's the tricky part, isn't it? Yes. Generally, these plants are not palatable. Horses with plenty of good grass or hay will usually leave them alone.
So why they eat them?
Well, there are a few key and sadly common scenarios. The number one cause, especially for acute sudden poisonings with things like oleander and yew, is ingestion of clippings.
Garden clippings,
Right.
lawn waste.
Exactly. Someone trims the oleander hedge, cleans up the yew bushes, and throws the clippings over the fence into the pasture, or mixes them with other waste that horses get into. This is huge. Never, ever feed yard waste to horses.
That's a critical message. People might think they're giving a treat.
They might, and it can be deadly. Another key point is that dried plant material can be the real problem.
More dangerous dried than fresh.
Often, yes, in terms of likelihood of ingestion. The bitterness might decrease when dried, making it slightly more acceptable, or it gets mixed into hay and the horse eats it accidentally. Oleander, yew, death camas, they remain toxic when dried.
So contaminated hay is a big risk too.
A very big risk. You absolutely have to inspect your hay, especially if it's from a new source or it looks weedy.
Okay. Well,
Scarce forage. If horses are in a poor pasture, overgrazed, maybe in a drought, and there's just nothing else to eat, they might start trying things they normally wouldn't touch, including toxic plants.
out of desperation.
Pretty much. And sometimes horses just stray. They get into wooded areas where things like rhododendrons or laurels grow.
Right. And does it matter which part of the plant they eat?
Absolutely. Knowing this is crucial. For oleander, all parts. Leaves, stems, flowers, roots. Fresh or dried, highly toxic. And get this. Our sources say as few as 5 to 10 leaves can be enough to sicken or even kill an adult horse.
5 leaves, that's nothing.
Scary, isn't it? For you, again, all parts are toxic, green or dried, except the little red fleshy cup around the seed, the aril. The seed inside is toxic, though.
Okay.
With grainotoxin plants like rhododendron, the leaves are usually considered the main risk. Avocado. Leaves are especially bad, but the fruit and seeds can cause problems too. Though there's some variation between avocado varieties, the Guatemalan types seem worse.
Good to know.
Death camas, the young leaves in spring, are particularly dangerous, but seeds, fruits, even the dried plant in hay can cause poisoning. And cheeseweed mallow, those cyclopropene fatty acids, highest concentration is in the seeds.
It's this rapid onset you mentioned.
Yeah.
Hours to maybe a day after eating it. That must make diagnosis incredibly tough, especially if nobody saw them eat anything.
It's a huge challenge. And like I said, sometimes the only sign is finding the horse deceased, particularly with yew or a big dose of oleander. There's just no time.
But if they are showing signs, what are vets looking for? How do they even start to figure this out?
History is absolutely paramount. The vet needs to know everything. Is there any chance of access? Any toxic ornamentals nearby? Recent garden work? New load of hay? Did anyone see the horse eating something weird? Any scrap of information helps.
The detective work first.
Definitely. Then the clinical exam. A really thorough cardiovascular assessment is key. Listening carefully to the heart rate and rhythm. Is it too fast, too slow, irregular? Are the pulses weak? Are there jugular pulses suggesting heart failure?
Okay.
Then looking for those other signs we talked about. Colic is common, often within hours. Loss of appetite, drooling, diarrhea, sometimes bloody. Maybe neurological signs like depression, muscle tremors, especially with white snake root or yew or incoordination.
So it's multisystemic often.
It can be. Difficulty breathing, sweating cheeseweed mallow can cause diffuse sweating, cold legs and ears. And with avocado, you might specifically see that swelling, that edema under the jaw or in the chest and head region.
So beyond the physical exam and history, what diagnostic tools can help pin it down?
The ECG electrocardiogram is really crucial. It gives a direct view of the heart's electrical activity. You can see those arrhythmias, the conduction blocks, the ventricular issues. It helps guide treatment too.
Like in human medicine.
Exactly. Blood work can also give clues. While general chemistry changes might be limited, you look for markers of heart muscle damage, specific enzymes like CK, LDH, AST, and especially cardiac troponin I. Elevated levels point towards myocardial injury.
So you can see the damage in the blood.
Yes. And electrolyte imbalances are common and critical to identify, especially high potassium hyperkalemia, which is dangerous in itself.
Can you test for the toxins?
You can. That's the definitive diagnosis, finding the specific cardiotoxin in the horse's serum, or stomach contents, or liver or heart tissue if it gets to a postmortem. You can also sometimes identify plant fragments by looking closely at stomach or intestinal contents.
Okay. And if the worst happens, do postmortem findings help confirm it?
Sometimes. In really sudden peracute deaths, there might not be many visible lesions. With Oleander, you might see fluid around the heart, hemorrhages inside the heart, and signs of muscle degeneration. You might show some hemorrhages and muscle changes too. Avocado poisoning often leads to fluid buildup in body cavities. Cheeseweed mallow can show clear heart and skeletal muscle necrosis. But for others like granotoxin plants or death camas, the lesions can be minimal or non-existent, which again makes diagnosis tricky.
Which underlines the importance of finding the plant, checking the environment.
Absolutely. Walking the pasture, inspecting the hay, looking around for suspect plants, getting them identified, that's often a vital piece of the puzzle.
Okay, let's connect this back. If poisoning is suspected, you said it's often a race against time. The outlook can be grim. What can actually be done for the horse?
It really is a race, and you're right, the reality is often harsh. For most of these cardiotoxic plants, there's no specific magic bullet, no antidote for horses like there might be for some toxins.
So the prognosis is often
Generally guarded to poor, especially if the horse is already showing severe signs when the vet arrives. Treatment is all about supportive care. You have three main goals: stop any further exposure, try to decontaminate what's already been eaten, and support the horse's body systems, especially the heart.
right. First steps.
Get the horse away from the source immediately. If you know what they ate, remove it. And call your vet. Don't wait. Time is absolutely critical.
And decontamination, what does that involve?
Activated charcoal is the mainstay. It's given usually via a nasogastric tube mixed with water into a slurry. Charcoal helps bind the toxins remaining in the gut, preventing them from being absorbed into the bloodstream.
Does that work well?
It helps. For Oleander especially, giving multiple doses of activated charcoal can be beneficial because the toxins can recirculate in the body. Mineral oil might also be used to help move things through. Gastric lavage, basically washing out the stomach, might be considered if ingestion was very recent and confirmed, but it has risks.
Okay, what about directly supporting the heart?
That's the next critical piece. 4V fluids are essential to help support blood pressure and circulation, and hopefully help flush toxins out. But crucially, vets usually choose calcium-free fluids.
Why no calcium?
Because, as we discussed, toxins like cardiac glycosides already cause calcium overload inside the heart cells. Giving more calcium could actually make the heart problems worse. So fluids like saline, maybe with a bit of dextrose, are often preferred.
Makes sense. And medications for the heart rhythm.
Yes, guided by that ECG monitoring. If the horse has dangerous rapid ventricular arrhythmias, lidocaine is often the first drug tried. If the heart rate is dangerously slow, atropine might be used, but very carefully, as it can sometimes cause other issues. Beta blockers like propranolol might be used for certain fast rhythms. It really depends on the specific arrhythmia.
Are there any, advanced treatments? I've heard of antibodies for digoxin poisoning in people.
Yeah. Digibine or similar Fab antibody fragments exist for humans and small animals to bind cardiac glycosides. Unfortunately, the efficacy in horses isn't well established, and the cost is usually prohibitive for such a large animal. So it's generally not a practical option.
Right, so mostly supportive care, fluids, charcoal, heart meds.
And managing electrolytes carefully, especially potassium, avoiding calcium solutions. Plus, general nursing care, keeping the horse quiet, minimizing stress, providing pain relief if needed, maybe gastroprotectants for the stomach lining. If there's edema, like with avocado, diuretics might be used.
And the outcome.
Like I said, often guarded to poor. Finding animals already deceased is tragically common with Oleander and ewe. But if treatment can be started really quickly, right when signs first appear, the prognosis can sometimes improve to fair.
But even if they survive the initial crisis.
Even then, they might have some lasting heart muscle damage, some scarring. That could make them less athletic or more susceptible to problems under stress later in life.
It's all pretty sobering. Which brings us, really, to the most crucial point. Prevention. Given how bad this is, prevention is clearly the best strategy. What should every single person listening be doing?
Prevention is everything. It really is. And it starts with education. You, the horse owner, need to be able to recognize the common cardiotoxic plants in your area. Know what Oleander looks like, know rhododendron. That's step one.
Know your enemy.
Exactly. Then, pasture management. Walk your pastures regularly, check fence lines, look for these plants. If you find them, get rid of them safely, dig them out. Don't just cut them and leave them there. And dispose of them properly. Don't throw them on the muck heap or compost pile where horses might get access later.
Right, because dried plants are still dangerous.
Critically dangerous for some species. Also, be super aware of landscaping around barns and paddocks. Don't plant toxic ornamentals where horses could possibly reach them, even if you think they won't. Assume they might.
And the clippings.
I can't say it enough. Never, ever feed garden or lawn clippings to horses. Just don't do it. It's one of the single most common ways these poisonings happen.
Okay. What about hay again?
Inspect it carefully. Every time. Especially if it's a new supplier or looks weedy. Open a few bales, look through them. Remember, Oleander, death camas, toxic, dried.
And finally.
Ensure your horses always have plenty of good quality forage available. Good grass, good hay. If they're full and content on safe food, they are much, much less likely to experiment with eating potentially toxic, less tasty plants out of boredom or hunger. And if you ever suspect exposure, keep the horse quiet. Minimize stress while you call the vet. Ultimately, vigilance and proactive prevention are just. They're the most powerful tools you have against this kind of devastating, often fatal threat.
That's so true. Knowing what these plants are, knowing the surprising ways horses get exposed, like those clippings, and just being really diligent about managing your horse's environment and feed, that's really the core message here from this deep dive. So maybe the final thought for you to consider is this. Safe isn't always static. It requires ongoing awareness. Vigilance really is your best defense against these hidden dangers. What will you look for in your horse's world next?